by London Mayor Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. We'd like to welcome the media who are in attendance this afternoon and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, as well as those listening on Global News Radio AM 980 and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Beth, and good afternoon, everyone. I know Londoners are looking forward to tomorrow when the Ontario government announces which communities will be moved into tighter or to less severe restrictions. Regardless of what happens, I'd like to give a shout out to everyone in London and in Middlesex for your efforts and sacrifice over the last while. It's not often a community goes from red down to orange or yellow. Typically, it goes the other way. In fact, since the system was adopted, I think Ottawa is the only mid to large-sized region to have its way out of red and down to a less restrictive category. It seems entirely likely that London will be moved out of red as part of tomorrow's announcement. And look, whether we're placed in yellow or orange as of Monday, it's a significant accomplishment. Our daily case counts are back down to what they were in October and November. We have fewer than 5 people in ICU in our hospital. And our total number of active cases across the region is back below 100. That's phenomenal. In fact, none of this happens without you. And by the same token, none of this could persist in the coming weeks and months without your continued vigilance. I've said it before, and let me say it again because it's so important. Color-coded restrictions may change. Our behaviors and our attention to detail must not. You can become infected with the virus just as easily and in the exact same way, whether we're in red, orange, or yellow. The good news is we can protect ourselves and those we care about in the same way. I don't need to remind anyone about those preventative measures because we can tell by the numbers. We know what they are and we know what to do, perhaps better than any other city across Ontario. What we need is a continued commitment from everyone to keep doing those things, to continue thinking of our most vulnerable, of our frontline and essential workers, our local businesses who are depending on all of us to continue getting this right, and for our families. So with all of that, thank you, London. You make me so proud of your continued efforts. Now over to you, Warden Cathy, please.
Great. Well, thank you very much, Mayor Ed, and it's wonderful to be with everybody on this bright, beautiful Thursday afternoon. I don't know about you, but the last couple of days has certainly reminded me of the promise of spring. I've been inside most of this week attending a virtual conference. However, I have made the commitment to myself to get outside for some much needed fresh air. And I have been so pleased to see the snow begin to melt, the icicles drip, feel the sun on my face, and begin to notice the first fragrances of spring. All that coupled with the COVID positive numbers that our region has been experiencing of late provides a spring in my step. I'm going to sound just like the mayor did and congratulate our community for the work that we have been doing. We all have reason to be buoyed by the numbers. It does confirm that hard work and perseverance, sacrifice pays off. It is incredibly gratifying to see the direction that we've been headed in. That being said, again, I'm going to sound just like the mayor. As restrictions become loosened, we cannot see, and we begin to see that light at the end of the tunnel. We cannot take that, though, as a green light. Full speed, go ahead allowance. We must still be vigilant. We must still be mindful of our essential trips, and we must still be considerate of how we are gathering. I want to take this opportunity to thank the residents and businesses in the county, in the city, for your efforts. It is with appreciation, it is noticed, and it is paying off. But please keep it up. Over to you, Dr. Mackie.
Thank you very much, Madam Warden. And thank you to Mayor Holder as well. I think the note that has been struck is exactly where we need to be right now. We should absolutely be celebrating the success of this community in bringing our rates of COVID-19 down. Our rates here in Middlesex and London now are lower than any other large community in Ontario. It's a huge success, and also it is vulnerable. So as we celebrate, let's do so remotely, let's do so with masks on, keeping our distance, and still staying home as much as we can. The local numbers, just 8 cases today, no deaths. That continues a streak since February 12th. Our last death reported February 13th in this area. We will likely have additional deaths as this pandemic continues, but we absolutely should be celebrating the past 12 days with no fatalities. That's great news, and that's what we're all trying to achieve. Speaks to the careful measures that all of us in this community have been taking. It speaks to the appropriateness of the vaccine campaign targeting those in long-term care or retirement home, where we know the mortality has been highest and is really a tremendous positive. We had over 1,100 vaccines given just in Middlesex and London yesterday. Bulk of those at the Agriplex, also some at the Mount Bridges Clinic and in our forward deployment in retirement homes. So that campaign is going well. We have capacity to expand the vaccine campaign and are just looking forward to having more doses available. I know that there is some interest in where our community will end up. Certainly, we don't have certainty right now about what level our community will be at as of Monday. Will we be reduced to orange or yellow level of restrictions, or will we actually, there's also the possibility that across the province, there will be additional measures taken to prevent the spread of variants of concern. We got our 8th case of a variant of concern, just 2 over the past week or so. But that 8th case did come in this week, 7th and 8th case this week. So we know the variants of concern are arriving in our community, and just very much hoping that we're able to get vaccine distributed enough that, and also people continue to take protective measures, that we don't see widespread case counts of variants of concern in our community. Beth, I will pause there, and I know we've got some questions, looking forward to them.
Thanks, Dr. Mackie. Yes, we do have a number of questions in queue, so we can get to those right away. Off the top, we have a question here from Jennifer Beeman with the London Free Press. Dr. Mackie, it is for you. Is the health unit expecting it will be able to begin vaccinating people 80 and older before the province's mid-March target?
Yeah, the campaign is going well here in terms of our highest risk healthcare workers. We've been able to get a good proportion of them vaccinated. We will continue into the very high priority healthcare workers soon, and we anticipate being able to move into the over 80 crowd sometime mid-March, maybe sort of early mid-March rather than later mid-March. So look for more information about that Monday or Tuesday of next week.
Great, thanks very much, Dr. Mackie. Another here from Jennifer Beeman with the London Free Press. It is for you. Is the health unit developing its own appointment system, or will it use the province's interface?
Yeah, so in partnership with London Health Science Centre, we do have an online booking system that we're using right now in the mass vaccination clinics. It's called Virto, and we've been using it for about a week or 2 now, and expanding the use. Great system, allows us to segregate appointments for certain subpopulations, and links in well with telephone-based appointments as well. So for those that don't have access to the internet, we still are able to make those appointments.
Great, thanks very much, Dr. Mackie. We do have a number of questions in line here from Jennifer Beeman, so I'm actually just going to break them up a bit with a few more questions that we've got from others down below. We have a question here, Dr. Mackie, for you from Matt Trevithick at AM 980 CFPL. Dr. Mackie, does the news today regarding deliveries of the Moderna and Pfizer vaccines impact the health unit's timeline for opening the next 2 vaccine clinics?
Yeah, I would say we need to understand exactly what impact that will have here locally. We are hoping to have at least one of those clinics up and running at some point next March, ideally both, but that's all dependent on vaccine supply. And you know, the news today doesn't give us clarity on what that actually means for local supply. So as soon as we understand that, we'll be able to make those decisions.
Great, thanks very much, Dr. Mackie. Another question here from Jennifer Beeman with the London Free Press. It is for you. What will the health unit be doing to reach seniors 80 and older when they are eligible for appointments?
Yeah, so we have a few things we'll be doing. First of all, media has been tremendous in supporting this campaign throughout, so we'll definitely look to your support for getting the message out. We're also planning to work with primary care providers, healthcare providers who would have, you know, rosters of clients and be able to easily identify those that are over 80 to be able to get that information directly out to them. The other thing we'll be doing is we'll be asking family and friends to make sure that their people who they know that are eligible over 80 are able to get an appointment as quickly as possible and help facilitate them making an appointment. We know that the media consumption preferences of that demographic are very specific, and we're going to do our best to align with those.
Great, thanks very much, Dr. Mackie. Another question here from Jen Beeman. Dr. Mackie, how many vaccines are being administered in Middlesex and London daily? What will this increase to when the 80+ crowd is in the queue? Oh, Dr. Mackie, you're just on mute there.
At the moment, we're vaccinating over 1,100 people per day in the Middlesex and London area. That's a count specific to our programs, but it does include some from outside of the region who would be accessing the vaccine at the Agriplex clinic. As you know, we partnered with the here in Perth Public Health and Southwestern Public Health on access to that clinic. So we have capacity for more right now. The limiting factor is primarily vaccine supply. We can ramp up to 1,500 easily with the capacity we have, essentially at the drop of a hat. We can ramp up beyond that with the 2 mass clinics if and when vaccine supply is available to do so. And of course, we have those other clinics that will be coming on board soon.
Great, thanks very much, Dr. Mackie. We have a question here from Salma Hussein. She's from Fanshawe's and Terabang newspaper. Salma is joining us for the first time, so welcome and thank you for joining us on the briefing today. Salma, the question, Dr. Mackie, for you from Salma is, when will the vaccine be available to local Indigenous communities in the London area, and how do you plan to include and make the vaccinations accessible for local Indigenous communities?
Really appreciate the question. So all of that will be announced soon. Look for more information Monday or Tuesday around opening up eligibility to Indigenous adults. There will be a dual campaign there. You know, the access through the mass vaccination clinics will be provided for Indigenous adults, and then we'll also provide access right on the Indigenous communities in partnership, and all of this is being done in partnership with Indigenous leaders in the community, Indigenous healthcare providers, and the populations that we'll be planning to serve. That's been a very collaborative process, and very grateful to our Indigenous partners for sharing their wisdom and helping us to set those operations up for success.
Great, thanks very much for that response, Dr. Mackie. We have another question here from Jennifer Beeman with the London Free Press. It is for you. It actually got moved over to the published column, so it's I'm just reading it from a different area here. Dr. Mackie, what is the health unit's plan to reduce vaccine waste? Will the health unit have an on-call list of people who can arrive with short notice if there is a cancellation?
Yeah, so this is something we've been doing since day one, and there really isn't vaccine waste in our campaign. Because there are so many people interested, it's very easy to pull people in. What we do is that, and we're talking about very small numbers here. So when we're operating two mass clinics and a forward deployment, you know, the max you could possibly have at the end of a day would be 15 doses, you know, a vial of 6 where you've only used 1. So it's easy to pull people in from the groups that are already eligible, that are able to be mobile and come to that facility where those doses are. You know, for example, when we're in a long-term care or retirement home, we bring enough doses to cover the residents of that home, and then at the end of the day, if there are a few doses, we offer those to the staff who may be there as well, or essential caregivers. On the Agriplex facility, for some time, we've had an end-of-day process where there are a number of healthcare providers sort of on call and available short notice, so that if we do have vaccines left over, we can pull them in. Again, we're drawing from eligible groups right now, so this isn't a situation where you can kind of show up at those clinics and be put on a wait list. It's very much something that we're able to manage right now within the eligible groups, and so we really haven't had vaccine wastage in the COVID campaign this far.
Great, thank you very much for that response, Dr. Mackie. We have a question here from Steve Young, CTV and News Talk 1290, CJBK. I think it could apply to everyone here on the briefing this afternoon. So I'll read the question first of all. It's yellow or orange. What are you hoping for? So I wondered, Dr. Mackie, if you have a comment, and Warden Cathy, if you also wanted to jump in with a comment on that as well.
You know, I think, Beth, I'll defer to my elected colleagues for this. I'm happy to share my perspective, but I think their voice is really important on this.
Great, thank you.
Thanks, Dr. Mackie. I think you could probably call me Cautious Cathy as to how I'm going to respond to that. I think we can get very excited by the numbers that we've been experiencing the last, week, 10 days, 14 days. And we could say, you know what, we deserve to be in yellow. But I really am hoping that there will be a cautious approach and that we will enter the stages incrementally. So go from red to orange to eventually yellow, and then, of course, hopefully green. Because I just think that a jump from red to yellow, while everybody is doing such a great job, and I have faith that they'll continue that, I know that there'll be some overzealous residents, businesses that might take a jump like that and think that it's a go-ahead for that we're completely out of the woods, and certainly we're not. So I would really hope for a cautious approach tomorrow when the announcement's made.
Great, thank you, Warden Cathy, for that comment. And Steve, I know you had directed the question to Mayor Holder as well. He actually had to just pop off. I'm sure he would have been very happy to add his comment to that question as well. So thank you both for your response there. Our next question comes to us from Jane Sims with the London Free Press. This question is for you, Dr. Mackie. Some primary care providers have expressed some surprise that they were identified as sources for identifying the 80+ community. Has there been a formal outreach to those doctors?
Yeah, so we've been working with primary care providers who are interested in working on this for many months, essentially even before the vaccine campaign was announced. We've got some great primary care leadership in this area. London Middlesex Primary Care Alliance is a great example, but lots of others. And so, for those that are interested in connecting on this, there have been lots of connections. As an example, when, even before the Agriplex campaign was announced, we had dozens of family doctors volunteering to be part of the vaccine campaign on site in the Agriplex, so not in their clinic offices. And there's now a list of over 200 who are willing to help out when needed there. So there's been a lot of work there. And then, as we begin to define those lists of those over 80, primary care will be a key partner. They've got that information that we don't have direct access to. And so, as I think of my colleagues in primary care and reflecting on their commitment to their patient population, I'm, looking forward to receiving that information and working with them on the campaign.
Thank you, Dr. Mackie, for that response. We do have a question here from Travis Dolany with CBC London. Travis would like to know, just building on the appointment booking system we were chatting about earlier, will the Mlhu Virto booking system be supplemental or overridden by the province's system once it launches?
Yeah, so it's the province launching March 15th, but my understanding is they won't necessarily be launching in all health units at that time. And we're also of the understanding that they won't be forcing use of that system. So, right now we've got a system that's working well. It can be adjusted locally to meet where we're at in the campaign. And that's where we're planning to continue to work for the foreseeable future. Big thanks to London Health Sciences Centre, who has been really champion of that system and able to help us get it up and running at all of our mass vaccination sites. It's a huge asset to have a system that works that well and partners that are able to get us oriented and know how to use it.
Thank you, Dr. Mackie. We have one final question here from Jennifer Beeman with the London Free Press. It is for you, Dr. Mackie. When eligibility opens up to Indigenous people or the 80+ crowd, is the health unit expecting a crush of calls or flood of traffic to the website? Will people need to be patient?
Well, yeah, I think patience has been the order of the day for this campaign, hasn't it? There has not to date been enough vaccine for everybody that wants it. So that'll be part of what happens as each time we increase eligibility. We definitely are working on, expansion capacity so they're ready for a flood of calls. We have been working, the City of London has actually offered their Emergency Operations Center, so huge thanks to them and some of their staff to help with the staffing the phone lines for the vaccine booking. And definitely we'll make sure that the website is ready to go for the volumes we expect.
Great, thanks very much, Dr. Mackie. That leaves us with no additional questions in queue this afternoon, so it will conclude our, we've got one more question. I know there's a bit of a delay, so I am actually going to respond or read this question. It is from Salma Hussein with Fanshaws and Terabang. Dr. Mackie, how do you plan to integrate the homeless population in the distribution plans for the vaccine? If you have time, I'm reading the side note.
Yeah, no problem. Thanks for the question, Salma. So we have seen in some places around the world the population of those who are homeless be at increased risk of acquiring COVID and of having a poor outcome if they do. And so they're definitely in the prioritization framework. They are phase 2 at this point and, not first in the queue in phase 2. So I would anticipate that we're able to start offering vaccine to that population in April. You can imagine there are significant logistical challenges, the most important one being the fact that we've got a 2-dose vaccine at this point. It's relatively straightforward to get out to the shelters, for example, and offer 1 dose, but to make sure the same clients happen to be there 3 or 4 weeks later when you go back for the second dose is a bit of a challenge. So that's something we'll work with partners. And of course, in the meantime, if we're able to gather enough evidence to say that one of the vaccines is sufficient in 1 dose, or if one of the Johnson & Johnson vaccine, for example, which is just 1 dose, gets approved in Canada before then, that would be a huge addition.
Great, thank you very much, Dr. Mackie, for taking that final question. That will now conclude our virtual media briefing. So thank you, Dr. Mackie, Warden Cathy, and to Mayor Holder for joining us this afternoon as well. We will be back on Monday at 2 o'clock. So until then, I hope that everybody has a great rest of the week and a wonderful weekend.